Hello, I'm Stephanie Grandy, and I will be leading you through this informational session on staging pressure injuries. Today we will be learning to accurately stage pressure injuries. Pressure injuries are often inaccurately staged. Nurses need to be able to accurately recognize the stage of a pressure injury for proper documentation and care. If pressure injuries are improperly staged, it can affect reimbursement for care services, place a patient at risk, and place the nurse at a liability. Our objectives are to assess and classify the staging of pressure injuries based on anatomical depth, soft tissue damage, and underlying structures. Understand characteristics of varying levels of skin damage for stage 1, 2, 3, 4, unstageable, and suspected deep tissue injuries, and apply knowledge learned to recognize and accurately stage pressure injuries based on photographs of wounds and/or description of tissues. We will also be doing a simulation exercise. In a stage 1 pressure injury, the skin is still intact. The skin would not be open. It would be intact skin with a localized area of non-blanchable erythema. So when you press down with your finger on the area, if it turns white and blanches, then it would not be considered a pressure injury. If it is non-blanchable, then it would be considered a stage 1 injury. Only the epidermis is injured in this stage, so the skin remains intact. The area may be painful, it may be warmer than the rest of the skin, the color would be pink or red, but it would not include purple or maroon discoloration because that would indicate a different type of pressure injury called a deep tissue pressure injury, and we will talk about that later. For stage 2 pressure injuries, there would be partial thickness loss of skin with the epidermis would be injured and the dermis would be exposed. Sometimes the skin is still intact and you would see a blister. The wound bed would be viable pink or red, moist, and it may present as, like I said, an intact or ruptured serum-filled blister. It would not be a blood-filled blister. You would not be able to see deeper tissues, such as adipose tissue. You would not see granulation tissue, and there would be no presence of slough or eschar. These wounds are usually shiny, but they can be dry, but they will be shallow open ulcers or intact serum-filled blisters. An easy way to remember stage 2 are the 3 P's: pink, partial, and painful. In a stage 3, you would have full thickness loss of skin. You would see adipose tissue. You would see granulation tissue, and there may be the presence of epiboly, which are rolled edges of the wound. There may be the presence of some slough or eschar, but for stage 3, if you do have slough or eschar, you would need to be able to see the deepest part of the wound. There may be undermining or tunneling. At this stage, you would not see fascia, muscle, tendon, ligaments, cartilage, or bone. The depth would vary by anatomical location, so it may be shallow over areas with little or no subcutaneous tissue, such as on the nose or the ear. And it can be extremely deep over areas with significant adipose or sub-Q tissue. For a stage 4 pressure injury, you would have full thickness skin loss and tissue loss with exposed or directly palpable fascia, muscle, tendon, ligament, cartilage, or bone in the ulcer. Here you can see in the picture we have tendon that is exposed. Therefore, you would say that this is a stage 4 pressure injury. An unstageable pressure injury would have full thickness skin and tissue loss. However, the extent of the tissue damage cannot be confirmed because you cannot see the base of the wound. It's obscured by the slough or eschar. You know that it's at least a stage 3 or 4, but you cannot stage it because you cannot see the base of the wound. In this photo here, you can see that we have both slough and eschar obscuring your view. Therefore, you would stage this as unstageable. A suspected deep tissue pressure injury could be intact or non-intact skin with localized area of persistent non-blanchable deep red, maroon, or purple discoloration. There may also be the presence of a blood-filled blister. This would be the difference between a stage 2 blister and a deep tissue injury blister, is that the stage 2 blister would be filled with serous fluid, clear or yellow, and the blood-filled blister, which is a deep tissue injury, would be filled with blood. Pressure injuries heal to progressively more shallow depth. They do not replace lost muscle or fat or dermis before they heal. Therefore, you would never reverse staging. So if you had a stage 4 pressure injury and it became more shallow, you can no longer see tendon or bone or fascia, then you would not change it to a stage 3. You would still call it a stage 4. We do not reverse staging. You would simply call the wound a stage 4 and document that it was healing or improving and document the depth. Pressure injuries are preventable. As a healthcare worker, it is your job to help ensure that this does not happen to your patients. You can prevent most pressure injuries by frequently assessing your patient's skin, turning the patient, using offloading methods such as pillows or wedges, and skin barriers. Think for a moment how you would feel if your friend or family member developed one of these preventable wounds. I will now take questions, and following the Q&A, we will have a quiz to see if you can properly stage pressure injuries yourself using photographs of wounds. The information provided in this presentation was compiled from the National Pressure Injury Advisory Panel and the Agency for Healthcare Research and Quality. Thank you for watching. We're now going to take our quiz and see what you've learned.